The record is live, so welcome everyone to our first FSHP Med Safety Journal Club. So this is a new initiative that FSHP is launching, and this is our very first presentation. Very excited to introduce our presenter, Timothy Carbone. So Timothy Carbone has been practicing in various settings in Florida since 2005. He is currently the clinical pharmacy manager for Jupiter Medical Center, and today he'll be presenting on the disrespectful behaviors in healthcare. So Tim, floor is yours.
All right, thank you. I kind of, have a little discussion here on disrespectful behaviors, which are, things that we hope not to see, but I'm sure we've all probably seen in one form or another during our careers. Disclosures, nothing to disclose at this time. Objectives, kind of looking at the current survey, looking back at previous surveys, and kind of seeing why it matters and what we can do to fix it. So September 2021, ISP conducted a survey. It was actually the third that they did. So they did 2003, 2013. Not quite sure why they did it in 2021 instead of 2023 and continue the 10-year mark, but they did do it last year. Again, kind of looking to see, how frequently these disrespectful behaviors are happening, and kind of assess like some of the other characteristics behind them. And then just looking at, throughout the years, they started with 6 questions, then up to 12. And last year they added a 13th question, which was more around virtual meetings and disrespect occurring during Teams meetings and stuff like that, which is stuff that we didn't have in 2003, 2013. So you can kind of see breakdown of who responded. A little over 1,000 people. You can see here that 2003, 2000, 2013 had almost 5,000. So quite a decrease in the number of total respondents from previous ones, and a good breakdown of all the different areas covered. Primarily acute care, but you do have some LTAC in there or long-term care in there. And then kind of breakdown of the roles, primarily nurses, but you do have a decent amount of pharmacists, pharmacy technicians, and then some other healthcare team members on there as well. Again, looking at, mostly frontline, you do have some management, and then you have, your other team members there. Good to see that, good portion of it is frontline, because that's, unfortunately, that's where a lot of it does happen, and a lot of it is seen or experienced. And actually, of the respondents, 2/3 of them have been in healthcare for over 10 years. So again, people that have seen a lot during their careers. During the survey, the question was actually posed as far as within the last year. So that those people that were in healthcare for 10, 20 years aren't reflecting back on stuff that happened 10, 15 years ago. Again, 6 questions. I don't know why that's 6 questions. So first question is, whether they had experienced it, witnessed it, or if they were aware of it, of the disrespectful behaviors. As you can see, 79% of those who responded had actually experienced disrespectful behaviors directed at themselves. And then we'll kind of go through the different questions, and then we'll get into the results after. These are all the different behaviors that they were looking for. I'm not going to go through and read them. You can kind of see, and then we'll kind of talk about some of them. We'll call some of them out. And you can see the other one, the last one on there, the disrespectful during virtual meetings, is the new one. Again, looking at, how often it occurred, gender of offender, And that is the full gamut of male, female, non-binary, and then also whether they were the person that was doing the disrespectful behavior was a rank higher or lower than the person that it was directed at. And, again, is it somebody that we've seen, it's only been one person that they've witnessed this from? Is it multiple people? And then what the 3 most frequent behaviors were as well. Again, how often it occurs, the frequency of effects is, how often they've seen this occur because of the disrespectful behavior. Basically a lot of it is, not wanting to reach out or, ask a colleague for assistance for fear of that disrespectful behavior being then directed at them. And you can kind of see these are the different prompts that they were given to, respond to either often, sometimes, rarely, or never. Often being the 10 or more times within the last year. And then these are all yes, no, I don't know. And then a lot of these also go into the plan, which is the second half of the presentation, as far as, what are the things that an organization can put in place to help prevent these disrespectful behaviors from occurring. And then one of the interesting questions on there is the next to last one is about COVID-19, as to whether they feel that pandemic contributed to an increase in disrespectful behavior. And then they did also have free text as far as specific medications that occurred that because of disrespectful behavior. And then the last question was the demographics, which we've kind of already gone through. And on here, you can kind of see, so these are the 2021 results. And, it's pretty significant across the board. And then one of the interesting things, that you see is, a lot of times when we think about it, we think that, it's a lot more of the men that are doing it, but a lot of the observations are actually that it's more common in females, other than the ones that are more physical, like throwing objects or physical abuse, are they actually the only ones where it's reported more frequently in men than in women. I'm kind of give a minute so you can kind of see some of these. And then, number of individuals involved, 75%, it was at least 3 different individuals that they had seen involved in these disrespectful behaviors, which is a little bit alarming, especially when you see that it's more than 5. And then again, the most frequently encountered, demeaning comments and insults, it's not really a place for that. Impatience with questions, interruptions. Again, how much does COVID play into that, into increased workload and stress? Again, not an excuse, but perhaps a contributing factor. And then when you see negative comments about colleagues and leaders, that's concerning as well. You never want to, especially if it's overheard by a patient, to have them think less of the people that are taking care of them. And then there were some that did have some, there were some of the throwing objects and physical assault was low, which was pretty consistent with the previous ones. And then 8% is a pretty high amount to be insulted due to race, religion, gender, or appearance. In this day and age, kind of surprising that it would still be that high. And again, the effects of disrespectful behaviors, again, how often they've seen this in the past year. And basically a lot of these is trying to do workarounds to either not have to ask a prescriber a question, or to just kind of push things through without questioning it because they were concerned about the disrespectful behavior and not wanting to be the target of it. And some of these are actually kind of low compared to what I would have thought. So it's good that, we're not working around too much. Although 20% is, or 20% of people, is a decent amount. Again, in past year experiences with disrespect favor, I altered the way I handle questions about medication orders 40%. So that's, 2 out of every 5 people have kind of changed their behavior because of disrespectful behaviors. And, having a clear, defined, effective process for handling it is important. Again, 55%, more than half, but still pretty low. And again, this goes into, the second half and the recommendations of, how to handle disrespectful behaviors. Again, and then, process for agreements allows you to bypass typical chain of command, only 41%. So there's a lot of organizations potentially out there that either don't have these mechanisms in place, or their team doesn't know about it. Organization deals effectively with disrespectful behavior, 25%. That's, I think, something that, is really an opportunity for improvement for the industry as a whole. I mean, that's pretty pitiful, to be honest. Then my organization manager would support me about 2/3. Again, not wonderful news, but it's not terrible either, I guess. And then, the COVID-19, 75%, I believe that has caused an increase in disrespectful behavior. Again, leading back to just now, increased workload, increased stress in the workplace. And the last one is pretty concerning as well, is 27% are aware of a medication error where disrespectful behavior played a role. That's a lot of medication errors that are just purely behavior driven, that, we have so many issues already with, systems and EHRs and stuff like that, that to have behavior play a role in medication errors it's sad. So kind of looking back into the previous surveys, again, so 2021, they broke it out into experienced and witnessed. Whereas before it was more, I believe it was just what had been experienced or were aware of. Again, 2003, they looked at 6 behaviors, 13, 12, and then they added the new one for 2021. And you kind of look and you can see that, 2013 seemed like there was some improvement made. And then come 2021, we kind of stepped back to either where we were before or worse. So 18 years later, we're kind of back at the drawing board. It's a lot of the same behaviors. So, I mean, if anything, demeaning comments and insults have come down. But other than that, we're pretty much right where we were. and I'm a visual person, so it's a lot easier for me to see stuff like this where you can kind of break it down and see. So these are the 6 questions that were available for all 3 surveys. With the last 2 columns being broken out for 2021 experienced witnessed. So again, you can see a lot of that dip and then right back up. This one is, again, these are the questions that were only in 2013 to 2021. So you don't see any of the 2003 data because the questions didn't exist. And again, you can see a lot of upward trends in those. All right, so just, some discussion points. Again, survey was 2021. So, we were still pretty heavily into COVID, 60-day span, which, may have played a role in, there only being 1,000 people that filled out the survey. Previous surveys were about 60 days as well, where they had the survey open. Again, pandemic effect, or people not necessarily checking their emails as often, not seeing the opportunity from ISMP to fill out the survey, or just not getting to it. One thing's, we're dealing with just pure percentages. So there really wasn't a statistical analysis to it to see, was there a difference? Is it the same? Is it possibly just sampling error where, again, the people that are going to respond to the survey are the ones that, have seen it and want to voice that. So again, are the numbers higher than in reality? It's hard to really say. So some of the reported issues that did come out from disrespectful behaviors, there were issues with an anticoagulation with, orders for duplicate anticoagulants where, the nurse or pharmacist didn't want to call to clarify, out of fear of, again, being that target. Drug interactions, dofetilide, again, with poor renal function, and delays in therapy where, you kind of see it in the pharmacies where, the difficult orders that, you have to clarify kind of sit in there a little bit, until you are ready to deal with them. So, people were hesitant to make that call, or were asking others before they were making that call, and then, essentially creating a delay until when the patient was adequately treated. Some of the potential issues, low team morale. Nobody wants to either witness or experience these. Turnover, burnout. Again, had a lot of people actually leaving the healthcare field altogether, especially during the pandemic. So whether that has contributed to it and kind of an additive effect where, as more people left, then the stress got higher and created more disrespectful behaviors, which then led to more burnout. And then as an organization, there's a liability if you have hostile work environments, if that gets reported, it can be civil liability for the organization and even the management of the organization. I'm just kind of looking, this was a survey that was done, and seeing, a decent amount of people have quit their jobs. Some of these did go to other positions within healthcare. But yeah, you see there, 19% have at least considered leaving their job and the healthcare industry as a whole. The people that did stay in their jobs, a fifth of those were looking to get out of healthcare altogether. So now I get into the second part. I'm going to take a quick drink here. you know, what can we do to address these behaviors? And again, these are all ideas that ISMP has put out, looking back through the previous surveys in, 2003, 2013, they also kind of put out, what we can do about it. And a lot of them are the same. So it's kind of what we needed to do in 2003, we still need to do in 2023. Again, create the foundation, create the culture. It all comes, from the culture of the organization as to whether or not these behaviors are tolerated. Again, there's a huge movement for just culture. Reporting without fear of reprisal, and accountability. And, what I was telling my people is report, report, report. If somebody comes to me and says, oh, so-and-so is always mean, so there's docs me as we need those examples. Again, one report is an anecdote, but if we have individual events reported over time, that becomes data, and we can act on data. Organizations can act on data. We can help coach these individuals to help improve their behaviors, especially if they're not aware of the impact of their behavior. Recommend creating a steering committee, again, to create a healthy workplace. You want healthy, not hostile. Making sure that we are being respectful to each other. And that's everywhere. And again, on that steering committee, you kind of want everybody. You want from the top downs to kind of bring everybody together to have that discussion, that open communication of what the issues are, what the pain points are, and kind of how to prevent it, how to react to it, how to prevent recurrence. Again, prohibit retaliation. Again, if somebody's feels that there's going to be retaliation, they're not going to report. They don't report, we don't have the data, we can't take action. And open the dialogue, kind of ask for the information. People aren't always going to open up and share that this is going on. So sometimes you kind of have to poke and prod and pull it out of people. And then as you make changes, report back to the staff that had the initial concerns. Obviously, you can't disclose like HR related information as to, if somebody was put on administrative leave or if they were coached or counseled. But again, if there's changes that are made in the organization to try and promote respectful behavior, report that back. And then just establish a standard process for your, behavior improvement. There's a lot of them listed here. Doesn't really matter which one you use. Most organizations pick one over the other as the one that they use. I'm used to SBAR myself. But again, just make sure you have a process and you follow it and you stick with it. And have an escalation policy, and let people know what that policy is. Again, going back, we saw that, how there's a decent amount of people that reported that there wasn't a way to kind of bypass the normal chain of command, but, again, it may be there. It's just that people aren't aware of it. And, again, you want it to be clear and immediate. That's something that, you don't want these behaviors to continue. So you want to make immediate changes as much as you can. Again, develop a code of conduct. Intolerance of disrespectful behaviors. This one is one that has kind of changed from 2003. So the 2003 was actually more of, a no tolerance policy. But then kind of through the years, they've kind of seen that, there's that no tolerance policies don't really have the effect that we're looking for. Like we want to change the behavior of the person. We want to change the person, into somebody who's going to have respectful behaviors. So they've found that, it's better if you can take somebody who is disrespectful and kind of help them to kind of change, the way they talk to people, how they interact with people, to kind of be more respectful. Kind of helps the organizations a lot better than that zero tolerance policy. And again, making sure it applies to all, even if it's your open heart surgeon that brings in $15 million of revenue into the organization, they still need to be held accountable. Whether they're employed or not. If they're contracted, they still need to be held accountable. Encouraging awareness education, of course, make it mandatory. Don't want anybody to say, well, oh, I didn't know. Let people know what these disrespectful behaviors are, and what the impact is. Like, make sure people understand the why, that it's not just, necessarily about, it's not just the person that's the target of it that's impacted by it. It impacts the team, it impacts patients. And so you really do want to make sure that they understand the why. Again, report. Confidential, make sure you're actually investigating the reports. And, intervene. You don't want it to escalate just while you're collecting the reports. If there's something that is going on, have that conversation with the person who is exhibiting the disrespectful behavior. Last one, that limit potential contributing stressors. There's only so much you can do. Staffing workload, we all are dealing with staffing issues. Communication is something that, every organization I've seen can do better. It's amazing how much communication breakdown there is, either within departments, between departments, between, your C-suite to your directors to your front line, making sure that, there's a good communication chain there. And follow up, just because the reports don't come in anymore, it doesn't mean that, the behavior isn't still there. It may still be going on. It just may be directed more at people that are not going to report it. Or if people see that, the behavior is still going on, they may then fear to report out of seeing that essentially nothing has changed. So just make sure you do follow up to see, is it still occurring, or, whatever intervention you've done, has it actually had an impact? Kind of getting into the idea of, potentially having these SCEs. We'll have an assessment question. So which of the following are false? And they're all false.
D.
For females are more reportedly frequent offenders of non-physical disrespectful behaviors. And, kind of ideas, we're Sisyphus rolling that boulder up the hill, and, we're still back at the bottom of the hill. And that concludes the presentation. Any questions?
Hey, Tim, it's Bill.
Hey, this is Dorothy. Great job.
Thank you.
I had a couple of comments. I think that it was interesting to see the difference in the 2021 results compared to 2003 and 2013, and just the impact that COVID-19, I think, has had. We all know how it's impacted in many areas of our lives, but it was interesting to see the data for how it impacts behaviors and digital behaviors. I was a little bit surprised to see that there's still some fear of talking to prescribers. The one slide that you showed on the actions that they take before, when they need to take action or address something, and do I talk to somebody first, or just avoid it, or it all dealt with dealing with prescribers. And I thought that was interesting. Pharmacy has really been working very hard over the years to incorporate themselves into our disciplinary team. And I've seen relationships between pharmacists and providers, especially the younger providers, being very, being very engaging and wanting the pharmacist to have that conversation. So I thought that was an interesting slide. The next slide was about the one that showed the year over year percentages for 2003, 13, and 21. And it was noted, it was a little, let's see. Yes, that one. So the trends. So that's percentages, right?
That's percentage of people.
The numbers in the box are percentages. Yeah. So it looks like, in 2003, there were a lot of people that encountered it, and then it looks like we improved, and then it looks kind of either stayed the same or got a little bit worse. But but looking at the end, right, what's the real number? In 2013, like, there was 4 times as many respondents as 2021. So as a percentage, it's not really as significant as how many people said that. Does that make sense?
Yeah. And, I think between 2003, 2013, a lot of people could respond because, in around, what was it, 2006, 2007 is when the iPhone came out. So by 2013, everybody has one, whereas in 2003, smartphones didn't exist. So it wasn't as easy to respond. And then I don't know what happened with 2021.
That's true. And I think the last thing I wanted to say was just really, I appreciated the part about speaking of the organization and really how it's every taking part in it. But the training and education is great, and moving toward and away from the no tolerance and toward kind of behavior modification and helping to grow people is an excellent way to move forward. But sometimes, culture does start at the top. And so leaders and senior leaders could do all the training and education that they want for their staff, but they have to walk that talk. And I think that could be some of the frustration that people in healthcare see, is that everybody is not taught, reading from the same page. So I think in my experiences and what I've seen, that sometimes that's some of the problem. That's all I had.
Hey, Tim, it's Bill.
Hey.
So I'm listening, and first of all, thank you for putting this together and giving us a presentation on such a topic that, in my experience, I've seen, and absolutely everything you said is true. This magic bullet to fix everything and to teach people to be a good human, that's such a hard thing to ask, and such a hard thing to ask, where all opposite side can be such simple too. But the compassion piece, I think, is really hard to teach an individual, and I think a lot of healthcare professionals has that compassion. But that's the thing that is a struggle. And in my position, and past, you know, I'll never forget, I had a provider leave me a voicemail, my message, that he left a voicemail, and there was like expletives all throughout it, curse words throughout it. And I'm like, I can't believe this guy left me this message. So I forwarded it on to the chief medical officer, and the chief medical officer heard it, and he comes to me and goes, Bill, yeah, he shouldn't have done that. This person has done that. And he apologizes. And I said, well, he apologized to me. And so one of the things that's really tough is that these organizations is that they may have a provider with such a unique specialty, like you mentioned in your slides, that they don't want to upset the provider because they may be the only game in town and be able to provide that service. And so that makes it really tough for creating that culture. It's interesting, and one of my point that I want to drive towards is, you know, it does start at the top, as Dorothy mentioned, but when it starts at the top, it means you hire that way. And if you're an organization that when they recruit, you identify these people, and that's who you hire. And if they don't meet these characteristics, then you pass, because it's much easier to pass on at a time of hire than it is when they first come into your organization. And that just applies to both the pharmacy and any other healthcare professional. And that's one of the things within my department, when I look for pharmacists and technicians, is people, do they have the characteristics of showing that compassion towards other healthcare professionals and being a good person. But that's just my thoughts and my experiences with this. And this is a hard topic, and thank you again for giving the presentation.
Yeah, you know, you can teach knowledge, you can give skills, but you know, it's hard to really teach, you know, compassion and, you know, behaviors. Behaviors are something that people have been doing for their whole lives. So it's important, you know, yeah, again, when you bring them in and when you're screening them, is to make sure they are people that are going to fit with the culture of the organization that you want to see.